If you're turning 65, one of the biggest decisions you can make is choosing the right Medicare plan to fit your needs. With all the conflicting information, it can get pretty overwhelming at times to choose between a Medicare Supplement and a Medicare Advantage plan. After helping thousands of seniors navigate Medicare, we are here to clear up the confusion. I'm Chase Gruening, the founder of Gruening Health and Wealth, and in this video, I'm going to clear up the difference between Medicare Supplements and Medicare Advantage. I'll explain the differences in cost, coverage, exposures, and help you understand which one is right for you. Now, a lot of you, if you're turning 65, are probably getting inundated with information about Medicare Supplements and Medicare Advantage. We're going to go through both of these today in detail over the next 20 minutes and really break each one of these down and understand which one is the right one for you. And there's no right or wrong answer here. It's which one is right for you based on your needs and based on your budget. So we're going to go through this. When we put them side by side here, again, we want to understand our choices. Original Medicare, again, that's the foundation, A and B. Everybody gets Original Medicare when you go onto Medicare. Now we got to decide what goes with it. Okay, what goes with it? Do we want to pair it with a Medicare Supplement and a Part D prescription drug plan, which you can see there on the left-hand side? Or do we want to replace Original Medicare with a Medicare Advantage plan? Okay, and let's really break that down even further. So Medicare Supplements, let's focus here on the Medicare Supplement side. Medicare Supplements, you're going to pay that Part B premium, that $202.90 a month. No matter what, we cannot get away from that. You will pay your Part B premium unless you unless you're able to get some extra help of some type. The coverage, now the coverage with the Medicare Supplement, that's going to be the most robust coverage, the most comprehensive coverage. My in-laws, for example, they live in California, frequently visit us in Tennessee. Mike, he has a Medicare Supplement. Lenny, she has a Medicare Supplement. They have different prescription plans, but they both have Medicare Supplements. That allows them to have the exact same doctor and hospital coverage, whether they're in California or Tennessee, and see whoever they choose as long as they take Medicare. So that leads me to that next point, networks. It's going to have the most robust network, so it works great for Mike and Lenny no matter where they go. Part D, typically you're going to need a Part D plan, and that's where the coverage is going to differ. So Mike and Lenny, again, they have different prescription plans because they have different needs, but we're going to add that Part D plan and we're going to formulate that based off your prescriptions when it comes to Medicare Supplements. Medicare Advantage. So on the right-hand side here, Medicare Advantage, again, you have to pay that Medicare Part B premium. Now understand Medicare Advantage here is going to be a privatized plan. You're leaving Original Medicare and you're going to be taking Medicare Advantage. Again, you still have to pay that Part B premium, and then you'll have an additional premium for that Medicare Advantage plan, typically much smaller. Some are even zero premium, some give reduction benefits, but you're going to have some type of other associated premium depending on which Advantage plan you go with there. Typically less expensive than a Medicare Supplement. The coverage is going to be a little bit less robust, so you're going to have more out-of-pocket expenses. You're going to have some co-pays, some co-insurance, and you're going to have networks with this plan. You're going to receive more coverage or better coverage if you stay in the network, and some may have restrictive networks in this situation. Part D, the Part D is typically included in these plans, and these plans can come with additional benefits, which would be vision, gym, over-the-counter benefits, those types of things. So let's put them side by side again, and I love just summarizing this. So if I just take everything I just said and put it in a 30-second explanation of the two. Medicare Supplements, you pay more, but you're going to get more comprehensive coverage. There's no networks. You can go see whoever you want as long as they take Medicare, right? It's really the most comprehensive, most robust, the Cadillac plan, if you will. Medicare Advantage is going to cost less, but you're going to take on more exposure. It's going to be a lot like your group plan. Co-pays, co-insurance, networks, some restrictions. So if you have a great health year, a Medicare Advantage can be a less expensive option and provide you with some of those extra benefits. But if you have an unfortunate health year, you may have more out-of-pocket expenses with that Medicare Advantage plan because of that co-insurance, those co-payments, those deductibles, and those max out-of-pockets. Now, really important to understand, no matter which option you go with, again, Medicare doesn't cover everything. The common exposures we see are cancer, heart attack, and stroke. And long story short is if you have one of these illnesses, you're going to have non-Medicare approved expenses that Medicare doesn't cover. We see it time and time again. The biggest exposure that no one talks about that Medicare leaves you with is going to be skilled care, assisted living, nursing home care. And I want to make this super simple here.
days 1 through 20. That is the most coverage that Medicare itself will give you. And you have to check a couple boxes in order to get these 20 days. You have to have a 3-day hospital stay overnight, and you have to be improving to get any coverage at all. After day 20, your Medicare Advantage charges you a copay, typically around $217 a day for days 21 through 100. So you do the math on that, it's about a $16,000 expense. Medicare supplements, sometimes they will cover that 21 through 100 days if you have that 3-day hospital stay and you're improving. Now that bottom bullet right there, after 100 days, you are responsible for all cost. It does not matter what Medicare plan you have. You would either need to have some type of plan in place to cover assisted living, extended care, recovery care, or you would need to self-pay through retirement, through your assets, or spend down. So we see this so often that this can be such a big expense and really deplete your retirement accounts. And it's from improper planning and not enough education around this topic. So this is one of the biggest areas we see of concern, and just want to make sure you're aware of this more than anything. You can even see it here in your Medicare handbook on page 26, I believe, the 2026 Medicare handbook. It's going to talk to you about the inpatient, outpatient risk and how Medicare is not going to always cover these assisted living or these out-of-pocket expenses in relation to this. So it's right there in the government handbook, in the fine print. It's very important that we know about this. So how do we eliminate all this major exposure I talked about? How do we eliminate the major co-pays, co-insurance, out-of-pocket expenses for the cancer, the heart attack, stroke, recovery care, assisted living, major hospital stays? Well, it's through these umbrella coverage options. So I want to make it very clear, no matter which option you go with, we always recommend umbrella coverage to coincide with it. And obviously the umbrella 3 is going to be the most comprehensive option. That's going to be your Medicare plan paired with your cancer, heart attack, stroke, your dental, vision, hearing, or hospital plan, and then your recovery care, which would cover you in that assisted living and often home care type of situation. And we can always scale that back based on your needs and your budget. And a lot of these things we have to make sure that you can actually qualify for. So based on your ability to qualify for an umbrella package, based on your budget, we're going to walk through which one is best for you. But the umbrella 1, 2, or 3, we always want to make sure we have some type of umbrella package paired with your Medicare coverage.
What I want you to take away from this video is Medicare doesn't cover everything, no matter which option you choose. The biggest mistake you can make is not understanding each plan's exposures, especially around major illness and extended care. If you want help to make sure you found the Medicare plan that's right for you, or have any further questions about what I've gone over today, there's a link in the description below where you can book a one-on-one call with our team. Also, feel free to drop any questions you have in the comments below. I'll be sure to answer those personally. If you've liked this video and want to see more of our content, make sure to hit the like button and subscribe button below. Again, Chase Gruening here, and thank you for watching.